Okay, so we have been dealing with the endocrine glands, and we know what is an endocrine gland, and also we have also seen a list of what are the major endocrine glands of the body. And regarding one endocrine gland, that is a pituitary, we have studied about what are the major hormones produced by the pituitary gland. And now we move to the next endocrine gland, that is the thyroid gland. Actually, thyroid gland is a gland located on our neck region. Here you can see a picture of that. Maybe somewhere here you can find. I will show you a picture where thyroid gland is actually situated. It is located on the neck region on either. See here you can see that. So this is how the thyroid gland is actually located. It's on our neck region on either side of our trachea. So this is the thyroid gland. So this is how the normal thyroid gland will be appearing. Now in case of thyroid gland, there are actually two portions on right side as well as left side, and there is a connecting bridge like portion also here. So this is a view of the thyroid gland. Now a thyroid gland is composed of two lobes. That was what I was mentioning. There are two lobes. This is the right lobe and this is the left lobe, and located on either side of the trachea. Here also you can see this is the trachea, and these lobes are situated on either side of the trachea. You can see that. Then, and both the lobes are interconnected with a thin flap of connective tissue called isthmus. Here you can see that. This is the right lobe and this is the left lobe, and both are connected by means of a small tube known by the name isthmus, a small connection known by the name isthmus. Here you can see that. I will give an enlarged view of that. So this is how, this is the right lobe and this is the left lobe, and this interconnection is known by the name isthmus. Now along with the thyroid gland, there is also a smaller gland which is called the parathyroid. And about the parathyroid we will study after the thyroid gland, and this is how a thyroid gland will be normally appearing. Now each thyroid gland is composed of follicular cells and enclosing a cavity. That also I will show you how the follicular cells of a thyroid gland will be appearing. Here you can see that this is how the thyroid gland will be seen. So this is a view of the cross section of a thyroid gland. If you are taking a thyroid gland, it is actually composed of this kind of, this is the tissue structure or cellular structure of a thyroid gland. So this is how normally the thyroid gland will be appearing on a closer examination. So if you look at the thyroid gland, this is the internal arrangement. So each thyroid gland is composed of follicular cells, and there will be cavity inside. This is known as the cavity. I will enlarge this one. So this is the nature of the thyroid gland. So you can see that, and this is the follicle, and inside the follicle there is a follicular cavity. So what you are seeing below is an enlarged view of the thyroid gland. Then you can also see that. So regarding the internal structure, each thyroid gland is composed of number of follicular cells, and there will be a cavity also. And these follicular cells which you are seeing below are actually producing two types of hormones. One is known as tetraiodothyronine or T4. Then another is triiodothyronine, and that is known as T3. The difference between T4 and T3, in the case of T4 there will be 4 iodine atoms. In case of T3 there will be only 3 iodine atoms. That is why tetraiodothyronine. Tetra means 4. Iodo means iodine. And so it's a hormone formed of 4 iodine atoms. Here this hormone is formed of only 3 iodine atoms. So that is why it is not triiodothyronine. we call by the name T3. Now regarding iodine, it is an essential for normal rate of hormone synthesis in the thyroid. Because if there is a deficiency of iodine, sometimes some people will be having enlargement of their neck. Normally what happens is that if our body doesn't have enough amount of iodine, what the normal behavior of the body is that to enlarge the size of the organ. So instead of 50 gram, it may be increasing to 500 gram. So there will be more cells, and each cell will be producing little bit of iodine, little bit of thyroxine, and the overall need of the body may be met by increasing the number of cells. But in that case, the size of the organ will be increasing, and that situation is known by the name goiter. Here also you can see how a goiter will be appearing. So this is the case of goiter. See here you can see that goiter is a situation in which there is an enlargement of thyroid gland. It may not be always very large, sometimes very small, especially in the early stage. Goiter can appear as a very small lump, and it can increase in size if the thyroid treatment is not given in a proper way. So this is how the goiter will be appearing. So in case of thyroid gland, and this is the iodine is an important mineral. If there is a deficiency of this mineral, that will be leading to the deficiency of thyroxine, and the deficiency of thyroxine can be usually met by an increase in the size of the thyroid gland, and there will be an enlargement of thyroid gland, and that situation is what we call by the name goiter. So goiter is a situation triggered by the low iodine presence in our body, or a deficiency of iodine in our diet. Then there is another situation known as hypothyroidism. Hypothyroidism, I will show you what happens in case of hypothyroidism. So in case of hypothyroidism, hypo means low. Low thyroid gland. See, these are the important problems of hypothyroidism. Here you can see that lot of problems can happen in case of hypothyroidism. Number of symptoms can happen, because hypothyroidism means a low thyroid thyroxine in our body, or the thyroid hormone may be very low in our body. That situation is known as hypothyroidism. Here you can see that it is affecting our mind, poor memory and concentration, poor hearing, the sound may change, the pulse rate of the heart may change, muscular problems will be there will be coldness on your feet, then the fatigue will be there, then the weight gain, and there will be poor appetite will be there, the shortness of the breath will be there, then skin can change, intestinal constipation, so then menarrhea will be there. So these are some of the important problems that happens due to the presence of this hypothyroidism. Actually, hypothyroidism during pregnancy causes defective development and maturation of growing baby, and that leads to a situation on by the cretinism. I will show you how cretinism is appearing here. So in case of cretinism, what we are seeing is that there is a low thyroid concentration in your body, and the presence of low thyroid concentration leads to, see, this is a case of cretinism. There is a stunted growth. So the thyroid hormone is a very important hormone needed for the development of our body. So if this hormone is not present in sufficient quantity or sufficient concentration, that will be leading to stunted growth. The physical growth may not be taking place. There will be mental retardation. The intelligence level of the patient will be very low. Then abnormal skin will be there. Then there is mutism. The person cannot hear or anything. So these are the problems that are normally affected because of hypothyroidism. So hypothyroidism can lead to cretinism. Lot of problems will be there. Most of the time the cretinism is actually exhibited by low height as well as mental retardation. So these are the problems of cretinism. Then in adult women, hypothyroidism can cause menstrual cycle to become irregular. That is, if normally this is a very common problem. Sometimes women may have hypothyroidism, sometimes they have hyperthyroidism. In both cases, it is problematic, especially with regards to menstrual cycle. So the problem is that is the thyroxine or thyroid hormones are very important hormones for our body. It is a hormone that is affecting entire systems of our body. That is any kind of change, either increase in the concentration or decrease in its concentration. Both can lead to adverse effect on your body, especially with regard to your periods or menstrual cycle. These thyroid glands are playing a very significant role in controlling the menstrual cycle. Sometimes because of hyperthyroidism, also the menstrual cycle, the periods may disappear for some time. So this kind of problems can happen. So thyroid hormone play an important role in regulation of BMR, basal metabolic rate. Basal metabolic rate is the overall rate of our metabolism or overall rate of different activities going on in our body. Then it is also an important and for the formation of RBC. So for the formation of RBC also this hyperthyroid glands are playing a very significant role. So that's regarding the some of the major functions of thyroid gland. Then it is also important for the control of your carbohydrate, proteins, fats. All these are actually controlled. That's why if there is a deficiency of thyroid hormone, that can influence your entire systems of your body. Then the maintenance of water and electrolyte balance is also influenced by thyroid gland. So how much amount of water should be present in your body? How much amount of sodium chloride should be present? This is known as the maintenance of water and electrolyte balance. So that is also controlled by thyroid hormone. That is, thyroid hormone has a lot of functions, and if there is a deficiency or there is a lack of thyroid hormone, that will be affecting your entire systems of your body. Then thyroid gland also secrete a protein hormone that is known as a thyrocalcitonin. So it is known as TCT. So the main hormone produced by the thyroid glands are thyroxine and triiodothyronine. And whereas in addition to that, there is a third hormone that is known as a TCT, otherwise known by the name thyrocalcitonin. And in case of thyrocalcitonin, its primary function is controlling the level of calcium in your blood. So when thyrocalcitonin is secreted, more calcium will be present in your blood. That situation is that is the situation of the thyrocalcitonin. It is controlling or regulating your how much amount of calcium should be present in your blood. Now, as we have seen earlier, we have told you about one hormone, one gland known by the name thyroid, that is known by the name parathyroid. This hormone, this is known by the name parathyroid. Now regarding the parathyroid, here you can see that it is a very small gland, but a very small gland closely attached with thyroid gland. The para means after. The meaning of the word para means after. So just after or near to the thyroid gland, we can see a very small gland, and there are 4 glands are there, 2 pairs, one here, one here. So one pair on the right lobe and another pair on the left lobe. So total 4 glands will be there, or 2 pairs of glands are there. So in humans, 4 parathyroid glands are present on the back side of the thyroid gland, one on each side of the 2 lobes of. So it is normally situated on the, not on the front side, it is on the back side, on the inner side. So this is the front side and this is the back side. On the back side you are seeing 4 small glands, and these glands are known by the name parathyroid gland, and their hormone is known by the name parathyroid hormone, always known by the name PTH. Now in case of PTH, it is regulating the circulating level of calcium ion. Earlier I have mentioned about the importance of controlling calcium level. So if there is too much PTH, it will be increasing the calcium level in the blood. So if your body is sensing that sufficient amount of calcium is not present in your blood, your brain will be triggering the release of PTH or a parathyroid hormone. When parathyroid hormone is secreted from the parathyroid gland, that will be stimulating to increase the level of calcium ions in your blood. So that is the case of parathyroid hormone. It is increasing the calcium levels in your body. Then PTH also acts on your bones and stimulate the process of bone resorption. Bone resorption means it stimulates the bone. That is, amount of calcium present in the bone will be reduced. That process is known as demineralization or dissolution. So calcium is mainly present in your bone. So when parathyroid hormone is secreted, what our body is doing is that it will be taking more calcium ions from your bones and bringing it to the blood. In that process, amount of calcium present in your bones will be decreasing, and that situation is known by the name demineralization. Then another is that parathyroid hormone stimulates the reabsorption of calcium ions by renal tubules. That is, the overall effect of parathyroid hormone is to increase the level of calcium present in your blood. So when parathyroid hormone is produced, the body will be transferring calcium ions present in your bone to the blood. That is one method. Another method is that it will be preventing the loss of calcium ion. It will be causing reabsorption of calcium ions from the renal tubules and increase the calcium ion absorption from the digestive tube. So from whatever area calcium can be brought to blood, it will be doing. One from bones, it will be bringing calcium. From stomach, from the digested food, it will be absorbing more calcium. From the renal tubule, it will be reabsorbing more calcium. So it is thus clear that PTH is a hypercalcemic hormone. Hypercalcemic means, hyper means increase or more. So hypercalcemic means something that increase the level of calcium. So that is why it is known as it increase the blood calcium level. It's a hormone that is increasing the level of blood calcium in the blood is known by the name hyper, increasing in calcium ion. Similarly, there can be hypocalcemic one. So in case of PTH, it is a hypercalcemic hormone. Simply means that it will be increasing the concentration or level of calcium ions in your blood. And along with the TCT, it plays a significant role in calcium balance in your body. That is another function. So what is TCT? Here you can find that TCT is a thyrocalcitonin. So this is one hormone that is controlling blood calcium. Another is PCT. So both PCT, PTH and TCT, both together are acting on your body and controlling the level of calcium ions present in your body. Now we move to, so these are the two glands which are closely associated with the thyroid in your neck region. One is thyroid gland and second is known as the parathyroid gland. Then we have the thymus gland. I will show you where the thymus gland is actually located. Okay, now we will come to the next hormone, that is the calcitonin. So not calcitonin, thymus gland. So in case of thymus gland, let's show you first the picture how thymus gland is. So thymus gland is a very small gland. Here you can see the picture of the thymus gland. So it's a very small gland and the position of the thymus gland is somewhere here, almost near to the little below the just between on either side of your heart or either side of your lungs. You can, this is the position of the thymus gland. See, so this is where the thymus gland is located. So this is also a small gland Now regarding the thymus gland, its main function is during the childhood. So the thymus gland is primarily present during your childhood. You can see that. And when a person reaches adulthood, the size of the thymus gland will be, see, this is the thymus gland. This is the right leg and this is the left leg. The position is between the right leg and the left leg. So this is where the thymus gland is situated. It has a lobular structure. Lobular structure means formed of small balloon-like globe. That is a lobular structure. See, this is the thyroid gland. Below the thyroid gland, you can find little more bigger, not as small as the thyroid gland. And two lobes are present between the sternum and the heart. And thymocytes are the cells of the thymus gland, and they produce a hormone known by the thymosin, and they atrophies with age. That is, after the age of 20, the size of this gland gradually decreases. So it becomes more prominent in children. When a person becomes adult, the size of the thymosin gradually decreases or shrinks. So that is why it atrophies with the age. So regarding the thymosin, it's the globular structure located between legs, behind your sternum on the ventral side of the aorta. This is the ventral side. In case of our body, this front side is always the ventral side. And thymus gland plays a major role in the development of our immune system. So this is primarily a hormone, a gland producing a hormone known by thymosin, and the gland secretes a peptide hormone. Peptide hormone means protein hormones, and the name of these hormones are known by thymosins. And thymosin play a major role in the differentiation of T lymphocyte. So in our body, while we will be discussing about the immune system, there are 4 different types of lymphocyte. There are T1, T2, T3, T4 lymphocytes are there. So primarily this is a hormone that is controlling the differentiation of lymphocyte. You know that WBC are of 4 types, like lymphocyte, monocyte, neutrophil, monocyte, and these 5 types are there. And out of that, lymphocyte is an important type, and their primary function is producing antibody. And these lymphocytes can again be of different types, and one type is known by the name T lymphocyte. T lymphocyte actually is given that name because they are undergoing their maturation in the thymus gland. There are 2 types of lymphocyte. One is T lymphocyte, other is known as a B lymphocyte. In the term T lymphocyte is used if lymphocytes are maturing in the thymus gland. On the other hand, if B lymphocytes are undergoing their maturation in the bone marrow. So in addition, thymosin also promote production of antibodies to provide humoral immunity. It's also a type of antibody mediated immunity is known as humoral immunity. Thymus is degenerated in old individual, resulting in decreased production of thymosin. Then as a result, immune system of the old person become weak. So this is an important thing. So here you can see as a thymosin, that means the children, when a person during the childhood, the immune system will be more active, because the body of the child can be susceptible for attack by different types of microorganisms. So normally the body of a child will be more active, more prone to different types of diseases. So its body is therefore will be taking more immune measures to protect the person from different kind of bacteria and virus. So that is why immune system becomes more active in case of children and less active in case of the adult. So that is and when the immune system is more active, thymus gland will be more large. When the person is getting older, the thymus size of the thymus gland will be gradually decreasing, and that also will be that decrease in thymus gland will be also associated with decreasing the production of the hormone produced by the thymus gland called thymosin. So this is an idea regarding the different types of hormones produced by the thyroid gland as well as regarding the thymus gland. Now we stop here. You can take few questions.